Well, good evening and welcome to the Town Hall Get to Know broadcast. We certainly appreciate the fact that you are spending your Friday evening with us. We want to ask you, if you're watching on Facebook or YouTube, to share this video out to your friends. We're going to be talking about some great things this evening. We have Dr. Lisa Sanders here with us. She was on our board, our panel, for the human trafficking and the awareness with that. We're going to be talking about infectious diseases tonight. We're going to be talking about COVID. We're going to be talking about AIDS. We're going to be talking about HIV. We're going to be talking about our youth. And it's going to be a great show. It's going to be very informative. We're going to hear some great information. So I just ask you to share this out and stick with us too, because if you leave, you're going to miss something that's really important. So again, welcome. I hope you've had a good week. We're doing well on this end here. Welcome to Sarasota, Florida. I want to tell you a little bit about Dr. Lisa Sanders. She is an assistant professor at the University of Southern Florida, and she is also a pediatric infectious diseases doctor. She received her medical degree from the University of Florida in Gainesville. She's certified in internal medicine with a specialization in infectious diseases. She's currently the executive director of the Ybor Youth Clinic in Tampa, Florida. The clinic is part of the University of South Florida Pediatrics Department, and provides testing and treatment for HIV and sexually transmitted diseases or infections, excuse me, risk reduction services, and referrals to other community organizations for underserved youth from the ages of 13 to 24. So, we're going to be talking about our youth this morning. And without further ado, I will bring Dr. Lisa into the studio. Welcome and good evening, Dr. Lisa. How are
Thanks
you?
very much. Good evening to you, Stephen. Thanks very much for having me. Appreciate this opportunity to talk to everybody tonight.
I'm so glad that you are with us as well. And I really appreciate your sharing in the human trafficking. We're not necessarily going to go there tonight. We are doing fundraiser, everybody, though. We've been raising funds for survivors of human trafficking for about a month and a half now. We're going to be having a fundraiser next month. We're hoping to have a silent auction so you can purchase products from Layla Love, who is Rise of the Butterfly, where the proceeds go to the survivors of human trafficking. But we want to put an end to that. But we're talking tonight about infectious diseases and how that plays a role in our community. And of course, this show is about people like Dr. Lisa who are making a positive impact in their communities. And so, thank you so
Well,
very much again for joining us this
I
evening.
appreciate it, Stephen. I mean, the human trafficking issue is near and dear to what we do at the Ybor Youth Clinic. We see that in a lot of the homeless kids that come to the clinic. So, really, an important issue. Tampa is a hotbed for human trafficking. So, really commend you for your efforts to try to combat it. It is a big problem, and we need to do something about it.
We in fact do, and that's why I was raising that awareness. And so, thank you. Yes, and as a matter of fact, yes, you alluded to the fact that some of your clients might be, become, I guess, targets for these predators that are taking
Right.
advantage of them.
Particularly the homeless youth that we see, and it's not just females, it's males as well. We see it a lot in our kids, and it's it's something that's tough to pick up. They're not going to come into clinic and tell us about it, but what we see in clinic is the effects of being trafficked, which is namely the infections that you talked about, the sexually transmitted infections and the HIV that we see in these kids related to the fact that they've been trafficked. So, yeah, so a tough, tough, tough problem here.
It is, and it's not something that everybody necessarily wants to talk about, and it's kind of tough to hear about because it is drastic. It is terrible what's taking place, but we're going to try and put an end to that. And so, yes, tell your friends about that. You can actually go to my store on the lwnfoundation.org website. If you go to the store, that'll take you directly to Layla Love's Rise of the Butterfly, which is a foundation that has an exceptional clothing line that's brand new, and her artwork. And when you put LWN10 in the code, you will get a discount of 10%, and the net profits will go to help survivors of human trafficking. And so that's a great cause. It's so awesome. Layla's so great. And I appreciated what you did to share in that. And so we're gonna come back to that, though. We are going to have regather our guests from that panel and talk about that. But let's talk about infectious diseases tonight. So what are some of the most commonly transmitted sexually diseases that you're dealing with there at the clinic, Dr. Lisa?
So there are no shortage of sexually transmitted diseases that we see at the clinic. One stat. So you mentioned I actually am an adult infectious disease doctor, but I work at a clinic where we see youth and young adults. So the kids are 13 to 24. So one of the things I like to mention to people just to so they sort of get an idea of this problem in this age population. If you look at kids like 15 to 24, they make up about a quarter of the sexually active population in this country, but they get half of all the sexually transmitted infections. So, it's a very active, they're very active sexually, and it is a huge problem, and it's a growing problem in kids. The most common sexually transmitted infection that we see is chlamydia infection, close to 2 million of those in the country. Next in order would be gonorrhea. The third one would be syphilis. And then the least common is HIV. And HIV is actually the one where we actually have made the most progress in terms of HIV infections are actually going down. The other three that I mentioned, chlamydia, gonorrhea, and syphilis, skyrocketing still in this country. And like I said, in young adult populations, really a significant problem.
Are the younger generations maybe a little bit more promiscuous than they had been in the past?
I don't know that necessarily in the past, but I think just in general, if you look at sexual activity, I mean, they tend to have more partners, tend to be less good about using condoms, which will prevent the infections that I've talked about. So that's a lot of the problem. Chlamydia is a particularly tough one because a lot of times males that have that, and even females, are asymptomatic, so they tend not to come in as much for treatment. And then it continues to spread in the population. One thing to mention about sexually transmitted infections, the ones that I've talked about, we could stop those in our tracks because we have antibiotics to treat those. And if we could just get people, if we could change human behavior, treat all the infections that are out there, we could actually wipe those diseases out. But obviously it's not quite that easy because they've been around for a long time, and like I said, rates are rising even though we are well equipped to treat them. But it's just a question of people continuing to have sex without protection and the infection spreading.
So certainly having protection is going to be a good choice to start
Yep.
with, right? Yep.
Yep, no question.
So when they come to your clinic, are they able to get free supplies if they are,
Yeah.
have a
So
problem?
I'm really proud of our clinic. Our clinic, although we're a USF clinic, we partner with the Department of Health, and through the Department of Health, we're actually able to offer free. Prior to COVID, our HIV and STI testing was on a walk-in basis. So kids should just walk in whenever they wanted and get free testing.
That's
So very, very effective way to identify these infections in kids. And I mean, to give you an idea of how effective that method is of diagnosing these infections, about somewhere between 15 to 25% of our kids would be diagnosed with an STI just from walking in and offering the free testing. That's a really very, very high number for an intervention like this. But because of our partnership with the Department of Health, we're able to offer the testing for free. And because we're a youth-centered clinic where we try to make our clinic welcoming to youth and to all youth. So the kids that walk in there feel comfortable, and that's really crucial in getting kids to come in. You can't make it like a sort of a sterile kind of clinical environment where they feel like they're judged, or they feel like they don't feel comfortable. But our clinic makes them feel comfortable. Very effective way to get them to come in. Prior to COVID, the walk-in model was very, very good for us. And like I said, that the testing is free, and then we have very low cost treatment then for the infections that we diagnose. So a nice model for us.
So that's like a sliding scale for those that
We don't do a sliding scale because we don't have the staff to do that. A sliding scale is kind of complicated. You got to look at, what their income is and stuff. So what we do at the clinic is we charge a flat $30 fee to see a physician for whatever it is they're getting treated for, which is really a bargain if you look at the prices of antibiotics and how much it costs to actually treat these infections. And if they have insurance, we do take insurance. So we also will take insurance. That usually ends up a little bit more expensive than the $30 fee that we charge. And the other thing that we do is we're not going to turn a kid away. If somebody's got an infection that needs to be treated, we'll work with them. We're not going to let them walk out of the clinic because they don't have the $30 without the treatment.
Wow, that is so awesome. That's just wonderful, and just another reason why I've got you on this show too, because you're doing such great things for the community. I commend you
The
100%.
other the other important thing that we do, and kind of when we're talking about these sorts of things, like I mentioned, the treating of these infections is really easy. We got antibiotics, they work, it's not complicated. What's much, much harder is to address what I said, sort of the reason why these kids are coming into clinic with these infections. And we touched on it in the beginning when we were talking about the trafficking. Some of them have home situations, that they're not comfortable in. Some of them have mental health issues. Some of them just don't think about using protection and stuff. But the much more difficult thing in our clinic is trying to address some of those behaviors and working with the kids to try to figure out what can we do to keep them from coming back a month later with another infection. And that's the much more challenging aspect of what we do.
Well, and that's the important factor is to get them better, get them educated so that
Right,
they don't come back, right?
right,
Right.
right.
Yes.
Exactly. And that's why things like your program and getting information out there, I mean, knowledge is power. And that's what we try to do. We try to spread information so that kids know exactly what they need to do to protect themselves. And the other thing for a lot of these kids is getting them to buy into the fact that their health is important and they should be protecting themselves, that it's important, and make it a priority for them.
And then you obviously make them feel that they are important and that you care about them, and I'm sure that makes a huge difference as well. What
Yeah.
got you interested in and working with the youth?
Well, so my story is a little bit different, and I don't know if I think I shared this with you, that I actually was an adult infectious disease doc, and I started obviously not young. I started this back when HIV actually was in its infancy and just starting when I got out of medical school. And I took a very long break from medicine, stayed home, raised my kids. My husband was a doctor, and in our house it worked where I was home, he was working. And what presented itself to me a few years ago was this opportunity to do something in a clinic like this. For youth. The person who's the chairman of the University of South Florida Department of Pediatrics is one of my best friends from medical school, and she had been bugging me for a long time to come back to work. And this opportunity presented itself, and it was nice because it dovetailed with my interest in HIV, which is what I started with.
Mhm.
And I do, while I was not working, I had been fairly active in the community doing volunteer work. And because I had younger kids that were growing up, I did a lot of volunteer stuff with kids. So we always sort of had a heart for kids. So this kind of was a nice opportunity to, one, get back into medicine, and
Mhm.
two, do some medicine that was rewarding and made me feel good about what I was doing. And it would be tough after as many years as I was away to go back and do if I were a neurosurgeon, I couldn't go back after 20 years and do neurosurgery, but
Right.
this medicine is something I can manage and do.
Right. Now, maybe you can tell us about those early days because AIDS was the
Oh,
focus in the beginning, huh?
oh, you know, that was very, very interesting to come back to see what HIV is now compared to what it was when I started. And I remember the first HIV patient that I saw when I was a medical student up at the University of Florida. I mean, that was the era when people were worried. I remember in Florida, people were worried about mosquitoes transmitting HIV and people not wanting to go into rooms, and all of the stigma, which is still around about a gay disease, and
Mhm.
and not wanting to deal with it. And it was very, very difficult back then. And then the we had for a while we had nothing at all to treat it. Then we had AZT, but that was it. And literally all of my patients back then died. They all died.
Yeah.
um, and and they were, most of them were young men.
Yeah.
And I was a little bit older, so I would identify with their parents. And a lot of these parents were watching their young children die
Mhm.
from a disease that we really couldn't do anything about. So back then it was much more about sort of helping patients have a good end of life, as opposed to being able to actively do something with treatment. Now it is 180-degree difference. The average life expectancy for somebody with HIV is like 71 years now, compared to
Wow.
79 years with somebody without HIV. Now, there are some, there are some morbidity. There's some things associated with that, with aging with HIV, where it's kind of like aging with any other chronic disease, aging with diabetes, where there are some problems. But it's a totally different story now, completely.
So
And it's
there's
really remarkable. The medications are very well tolerated for the most
right.
part, very effective. It is a different ball game now,
Well, so
completely.
with the progression of healthcare and the medicines, there's been some great advances clearly in with respect to AIDS. So AIDS, like you said, that's well down the list now as a concern,
Right,
apparently, right?
right. But it's interesting to see what's happened to the HIV epidemic now. So as I mentioned, when I was first starting, it was something that we saw like in New York, in San Francisco, in gay populations. The
Hmm.
epidemic now, it's kind of sort of parallel to what's going on with COVID, disproportionately affecting minority populations. In particular, we see minority, Black, and Hispanic men who have sex with men. We use the term MSM. Um, in
Hmm.
the South, in particular, in rural areas, or in areas where being gay is not something that people can come out and say, and those people are not getting treatment that they need. And that, it's interesting. Again, with HIV, we have the medications right now. We have preventive medications and medications that can control the disease so that it's not transmitted, so that we actually could stop HIV in its tracks as
Wow,
well. If
that's
everybody
awesome.
that took, if everybody that was qualified would take preventive medication, and everybody that had HIV was on treatment, we could stop it right now. But
Wow.
again, like the other STIs that I mentioned,
Yes.
the people that HIV is infecting now, particularly in the South, do not trust the healthcare system, do not get in and get care, do not have the means to pay for medications. And so like COVID, sort of like what we're seeing, where these diseases are disproportionately affecting people in our society, people in our culture, that are disproportionately affected by all sorts of other things: unemployment, poor housing, inadequate food. And so, it's not just a health condition. I mean, these are big social issues that I think we have to face, and we have to, as a community, figure out what we're going to do to address.
Why do you think that people don't trust the healthcare system?
Oh, so it's hard as a physician. I mean, in Black communities, you go back to probably the Tuskegee study with syphilis, which is just a terrible black mark on the history of medicine. That was a study of syphilis where physicians let Black men who had syphilis did not treat them, even though we had penicillin, which is very effective against syphilis, didn't treat them in Tuskegee, which is, I think, Mississippi, Tuskegee, Mississippi,
Alabama?
Alabama. I'm sorry, Alabama. Yeah, Tuskegee, Alabama. Did not treat them because they wanted to observe the natural history of syphilis. You could never do anything like that now, but that's always brought up as feeding the mistrust that minority communities have in the healthcare system.
Yeah.
Um,
That's
I
kind of that's a shame, that they're holding that past, because I know that, number one, the whole idea of being a doctor is to preserve life. It's not about taking life for sure.
Right, right. But I do think, I mean, physicians are not totally blameless in,
Hmm.
in this whole thing either. I mean, there are, in some poorer communities and things, the healthcare is not up to the same standards, maybe as in some other communities. There are, if you look worldwide at some of the studies that are done with drug studies and even vaccine studies are done in poorer communities, and they do the studies in those communities, but then when the vaccine or the drug comes out, those communities can't afford it because of what drug companies do with pricing and things. So,
Hmm.
and we see things all the time. What's happened with some drug pricing, the pricing of insulin that we saw, the pricing of EpiPens that are life-saving pens that people need for allergic reactions. Price gouging with those things. There's reasons why people have a mistrust of the healthcare system, and we just, I think, as physicians, we have to continue to, like I said, it's a question of getting out there, being honest, being approachable, trying to spread solid scientific information so that people do, that we can build trust with communities. But it's tough, and we mentioned COVID. We've
Yeah.
seen it with COVID, with some of the misinformation that's out there, in the that's being spread by different media outlets and things. I mean, we've got a big hill to climb in terms of COVID vaccine to build trust with that as well.
Right, right.
Um,
Well, we're going to be talking about COVID in a moment here too, as well. And what you made me think about was Latina, who was also on the panel, was she speaks solutions, not just words, and how she's trying to help the underserved and underprivileged communities to be able to get health care, and helping that community, because I think what
right,
we're talking about, maybe that same community or type of people that are just maybe a little bit leery of the healthcare system,
right,
and trying to say,
right.
hey, look, there are answers, and that's what we're trying to do too at the LWN Live with Nature, with the referral center, so that we
Exactly.
can have these relationships with, like, yourself in your clinic, and be able to refer people so they can feel comfortable and they can get some solutions.
Right, right. And I think, it goes back to establishing trust. And honestly, the healthcare
Yeah.
system has sort of caused that to erode too. Every time you
Yeah.
make a person switch from one physician to another physician because their insurance doesn't cover stuff, you sort of erode that doctor-patient relationship. We've got a lot of problems that we've created with our healthcare system that are not going to be easy problems to fix, not easy to adjust to address. But we got to do something.
Well, and that's why we're talking tonight too, as well, because we do want people to know that there are people like yourself out there that are willing to do whatever it takes to help you, and to try and rebuild that trust in our communities, and that is important.
And I
I was
think the majority of physicians do. I mean, the
Yeah.
majority of physicians are really hardworking, care about their patients, and are just trying to take care of people the best that they can, sort of in this big healthcare complex that makes it a little bit difficult to do that now.
And there's so much confusion, I think, going on right now. Uh, maybe we
Yeah.
should just go there for this moment then, is that there is confusion about COVID-19. They're working on some vaccines. Now, my question would be is that okay? Um, my understanding is that viruses that there aren't cures for, and this is where I need you to clarify that there's not a cure for it, but like with the COVID, we can do something to stop that. Maybe you want to talk about how we can be preventing COVID as well as any other type of infectious disease.
Right. So we can, and I am a big, with infectious disease. I mean, what guides me is looking at the science, and there are some very powerful epidemiologic studies where they look at spread in populations. They'll look at spread on cruise ships. They look at spread in contained populations. Looked at it in New York City, and that data shows that wearing masks, washing hands, social distancing works. Staying out of closed indoor spaces with other people without masks works to contain this. And that's an effective thing for people to do. And I I don't know how wearing masks has somehow been conflated with personal liberties and taking away personal liberties by asking people to wear a mask. To me, if you look at what's going on in our country right now, I mean, wearing a mask is an easy thing to do. And I do think there is a lot of evidence showing that that's a very easy, very effective thing to do. So I do think everybody should be wearing masks in public spaces. I think that the social distancing makes good sense. I think if you're going to be around other people, you're much safer if you do those things outside, if you do it not in big crowds. There is clear evidence to show that this virus loves to spread in closed indoor spaces with lots of people together. And the numbers now in this country are scary. I mean, there is explosive spread going on right now, and it's just a question of numbers. This is all a numbers game. So, the more virus that's out there, the more likely you are to run into it if you're not being careful with what you're doing. So I think first and foremost, easy, wear masks, be
Well,
smart about what you're doing, getting
yeah,
together in groups.
absolutely, and we need to protect people that would be at risk for certain. Um, what I'm wondering is that we did take measures, and yet it kind of calmed down a little bit, but there's been a resurgence. Why do you think that happened?
Because we didn't take enough measures, because we relaxed our measures. Florida is a case in point. I it's very difficult. I mean, we've learned things as we've gone with this infection. There were people that thought that opening schools was going to be a disaster and we shouldn't do it. And what happened was, I think opening schools is actually a reasonable thing to do. If you look at the way spread is, and you look at sort of the overall benefit of having schools open and things, I do think having schools open is a smart thing to do. You got to be careful in schools. Doing what they're doing is smart. I think having kids in college, again, we saw a bump of spread in college, but you're contained on a college campus. I don't think that's a bad idea. But when you look at, and I think that in retrospect, closing beaches, closing parks, closing outside areas, that didn't make a whole lot of sense because it doesn't spread a lot there. But
Right.
when you look at things like bars and restaurants,
Hmm.
where we know it spreads and where there's not a great way to have those places open, maybe what we should be doing there, again, encouraging the takeout, encouraging other things, and maybe our economic packages should be focused on supporting those businesses where it's really tough to have those places open safely right now. I don't know. I don't have all the answers, but I do think the people that I listen to and that make the most sense to me are people that look at you look at the epidemiology, and what epidemiology is how is this virus spreading? Let's look at the numbers and let's look at what makes it spread and stuff. And
Hmm.
look at that and then try to make rational decisions about what are we going to do in terms of public policy. And it's tough to come up with a whole lot. What do you do in a bar? You got to have your mask off so you can drink. You're around a lot of people. It's tough to come up with scenarios to make that super safe, other than if it's something outside, like in Florida, we're kind of lucky. We can sort of, you can go to waterfront bars. There's a big wind going around the viruses. That's a different story. But up north right now, when it's starting to get cold and people are moving inside, it's tough to come up with good scenarios to have that be safe right now.
Does colder temperatures help to reduce the spread of the virus?
So I have not seen the data with this virus. I think everybody was hoping that this was going to be a seasonal sort of thing, like the flu is seasonal. And there is nothing to show that that's the case. There is some stuff looking, if they just look at how the virus grows and stuff. So if you put it on a surface outside in a hot temperature, where it's moisture and stuff, it doesn't last as long as if it's in a drier place where it's a little bit colder. But then I think you get to, if you take it up to Antarctica, maybe it's not going to do as well up there. But I think overall with this virus, in terms of, hoping that, oh, the winter's here, it's going to go away, or the summer's here, it's going to go away. That hasn't proved to be the case with this virus, unlike the flu, where we definitely do see seasonality. One
Right.
interesting thing to mention with the flu that we have seen in
Yes.
places where they've had flu season and they've done precautions with masks and social distancing, they have
Oh,
not seen near the flu as, near as much flu as they normally do, because it's what works for not spreading corona works for not spreading the flu too.
wow. So see, that's having another effect in a
It
positive
is. It
manner.
is. Now the concern is that next year, when flu comes around again, it'll be a worse flu season. But we'll see. We'll see about that. But for
Well,
right now, in places like Australia, got through their flu season with a dramatic drop in the number of flu cases that they saw.
well, and there you go. So that just is an example of how masks are working.
They do work. They do. They do. This is not this should be a simple thing. It should not be fraught with all the drama that's there. It really shouldn't.
Well, I know that President-elect Biden said, if I heard this correctly,
Yep.
that for the first 100 days or
Yeah.
something to this effect, he was going to require that everybody wear
Yeah.
masks.
And I kind of like that. I think, why not? 100 days, what the heck? It's like I said, 100 days, wear a mask. What the heck? Maybe it makes a difference. Go with help. It's everybody helping everybody with something like that. So yeah, I sort of thought that was a good idea.
Yeah, yeah. Now, of course, we've got our governor who says that he's not going to be. I don't
Mm,
know if he's responded to that situation, but
mm.
at this point, he doesn't want to have anything to do with that stuff.
No, I know. I don't get that, honestly, because you just look at the numbers in Florida. I don't really understand that. Again,
Are we leading the nation still, or we weren't we at one
I don't
point?
think we are now. I mean, there's some other states out in the Midwest and things where cases are just skyrocketing, but our numbers are pretty impressive in Florida in terms of absolute numbers and things. It's a shame. We may do better down here as the winter kicks in. Like I said, when people go inside up north and we can stay outside a little bit more, we may end up doing better. But yeah, I don't really understand the governor's response to things. I get the concern about the economics, but I think there's
Mhm.
ways to approach things where you acknowledge the economic problems and do what you can to mitigate those, but you also acknowledge that there actually is a virus out there that we need to do something
Yeah,
about.
absolutely, absolutely, and so I think that it has helped the hygiene aspect of it, washing the hands, wearing the mask, being more careful. That are really great benefits across the board in many ways. And that is good news that we're seeing lower numbers, like you say, in Australia, and with the flu right here in America, because that before, as I understood, was killing up to like 80,000 people a year. Just the
Yeah,
right
yeah. I
right.
mean, and that's always. I mean, even with vaccinations and stuff. I mean, the flu is a tough one, and the people that die from the flu would tend to be older people that are vulnerable. They get the flu, and then they end up with a bacterial pneumonia on top of it, and one thing leads to another, and they pass away. But so there's always going to be excess mortality associated with the flu too, just
Right.
like we're seeing with coronavirus too. I mean, the people that are dying from coronavirus are people that have, not everybody, but a lot of them have underlying comorbidities that are making
Right.
the disease a lot worse in them.
Right. They've got three or four other complications that are contributing to it, and not to back up, but I know that for like the AIDS patients, what was killing them back in the 80s and 90s was getting the flu or getting
Getting
pneumonia
another infection.
or getting hepatitis, and then that was pretty much curtains at that point for them.
Right, and because what HIV does, HIV is a little bit different. HIV attacks your immune system and then
Right.
makes you vulnerable to other infections. And when you get one, you can't get rid of it, and it makes you prone to infections that normal people would not get. But again, that is really number. I mean, because of the medications that we use to treat HIV, it reconstitutes people's immune systems, and when you're on HIV medications, you don't see that anymore. Like I said, that's totally changed. People used to die from pneumocystis routinely. A lot of times they'd present with pneumocystis as their first sign that they had HIV. You just don't see that so much anymore at all. It's really impressive.
Well, that is impressive, and we certainly are glad to hear news like that. We're going to go to a quick commercial here. We want you to know that we appreciate our sponsors. We have a couple of them now. We have Total Coatings here that do the refinishing of the bathtubs. If you want your bathtub refinished, or tile walls, countertops, and sinks with a safe, non-toxic porcelain glaze, they can do that for you. And if you're somewhere in the country or even somewhere in the world, they've got dealers all over the world, as a matter of fact, in 100 and some odd countries. So let's go to our commercial. We certainly appreciate their support. This is Total Coatings. Let's go ahead and watch this.
We let our bathtub go too long. It had rust in it, it had deep pitting in it, there were chips. I quite frankly thought it was unrepairable.
Total Coatings is a family-owned and operated bathtub and shower refinishing company. We've been around since 2006, but we use a exclusive non-toxic porcelain coating that was developed over 60 years ago by a franchise in California. So the product is very well established. We refinish bathtubs, showers, wall tile, countertops, and even sinks. Customers want to know what makes our product different, and that's, of course, the exclusive non-toxic porcelain. We also don't acid etch the surface, so you don't have to leave your home because of noxious fumes.
I was completely and utterly shocked. It looked like a brand new bathtub. I would recommend Total Coatings to anybody.
Well, we want to thank Total Coatings for that. If you want to save thousands of dollars over replacement, they're a great choice. Absolutely. We also like to thank the Cool Today company, and we certainly appreciate them. They are our newest sponsor. We'll be having some commercials for them coming up soon. We're looking forward to that. Uh, get the best from today with Cool Today. We certainly appreciate them as well. Thank you. So, Dr. Lisa, we've been talking about infectious diseases. We've been talking about AIDS and COVID, the pandemic. We've been talking about some preventative measures as well. Um, we talked about the fact that you love working with youth and the fact that you're making such a positive impact in the community. And again, I want to thank you for all that you're doing up there in Tampa. And I just wanted you to maybe tell the viewers about your responsibilities there. You're the executive director of the Ybor Clinic. Maybe you can tell us about that.
So that's been fun for me. It was like I said, it's a nice segue back into medicine. What I've been doing the past few years is actually sort of working on a way to make the clinic sustainable, because I mentioned, we don't charge very much for what we do, so it is not a money making proposition. But through writing for different grants, we have several federal grants where we're looking at effective strategies for HIV prevention, looking at doing some different screenings for substance use and other things. We've been able to get funding through the federal government and um, come up with a sort of sustainable economic model. So I've been working on that part of things, that administrative part of things. And the other part that's a lot of fun with what I do is sort of working to make connections with other agencies in the community. I sort of alluded to the fact that these kids have housing issues, food issues,
Mhm.
mental health issues, and we as medical professionals don't have expertise in dealing with some of those things, but there are a lot of great organizations in our community that do. So we've come up with a model where we work together sort of hand in hand with some of these agencies. When our kids need some help, we try to sort of do a warm handoff so that the kids, again, are comfortable with who we're referring them to. So that's sort of been another thing that I've been working on at the clinic. And then recently, I also have now reactivated my medical license, because I mentioned I hadn't practiced for a long time, and now actually am starting to see patients again, which is really a blast, which is a lot of fun. I really enjoy that, and working with the youth. In I guess the last component, because we're an academic institution, the other really enjoyable thing that I get to do is work with young people that are either public health professionals or training in their medical careers, and it's a lot of fun to see their energy, see their ideas, and sort of because our clinic is kind of we like to try things and see what works. There's not one thing that's going to work for all of these kids and deal with all these problems. But with the sort of the young interns and students that work with our clinic, I learn a lot from them, and we get to try different things that they think might be ways to impact our youth, and that has been particularly rewarding as well. So I really think my job is it's a blast. I get to do a lot of different things, and get to sort of end every day. You can't help every kid that walks through the clinic, but at the end of the day, I sort of, it's a nice feeling right now, especially in this day and age where the world sort of seems like it's kind of spinning a little bit out of control and you can't do things. It's nice to end the day feeling like you made at least a little piece of it better than when you started at the beginning of the day. And so that, for me, that's been tremendously rewarding, and it's also something that that kind of helps keeps me a little bit sane and keeps me optimistic at
Right.
a time right now when you can sort of lose that optimism a little bit in the world.
Yeah. A lot of people, well, we've seen a rise in suicides and in alcohol and drug abuse as a result of COVID.
Yeah,
People checking in for with mental health issues.
yeah,
And so, yes, the time is now where people need organizations like yourself at the clinic. I want to thank, of course, the LWN, where we can help people get to those resources like
right,
your clinic, get housing, get food, get clothing, and or recovery. Or mental health counseling, whatever it
right.
might take to try and help people through this, because this is where we need to come together, correct?
Yeah,
As,
and that's why I wish that message sort of would get through, is that, it sort of seems like, unfortunately, instead of bringing us together and recognizing that, we need each other to get through this kind of thing, we've ended up sort of at very divided and very divisive things going on that
yeah.
really are. I wish we could get past that stuff and recognize that we need each other, and we all have more in common than we do things that separate us. And unless we work together, we're not gonna. we, the future looks kind of bleak if we don't.
Well, this last year has been, I can't say that I've ever experienced anything like what we've gone through this last year ever in my
Yeah,
lifetime.
yeah,
And it, you know, not that I want to go to politics because I got to stay away from that stuff. I do, but the fact of the matter is that there is a huge division in our country right now,
Right.
and that's what we need to identify. Like you
Right.
said, is that we need to come together right now. This is when we need each other. People can have differences of opinion, and you know
Exactly.
what? We have to say that that's okay. It's all right,
Exactly.
you know. So we
Yeah.
don't agree with somebody doesn't make it so that we shouldn't talk to them or that we should be mean to them. This is the opportunity now to
Right.
really
Right.
change what we're doing in our lives. To let's
Yeah, and you
really
can always, I mean, you can learn things from people with different opinions, but you got to be able to
yeah.
talk civilly to each other. And when you can't do that, then you're never going to get past some of these problems that we have. So, I
Yeah.
mean, hopefully, we'll be able to do that.
Well,
Um,
that's the key is talk civilly. Everybody. It seems like what's happening is that if you don't agree with the person that's saying something, then all the next thing out of their mouth is calling names and
right.
you're
Right.
wrecked and whatever. And it's
Right.
like, wow.
Right.
I
Right.
don't know why it's gotten so what I would consider really out of hand, but the fact of the matter is that if you, the viewer, are watching this and you can identify with this, let's just be kind to our neighbors.
Exactly. Yeah.
Let's be
Yeah.
kind to our neighbors. Let's get to know our neighbors. As a matter of fact, when we were doing the human trafficking, one of the things that Jason Cisneros said was go out and get to know your neighbors,
Right.
get their phone numbers,
Right.
give them your phone number so that if something happens or they need something, they can call you. So I
Right.
think that's a really awesome thing.
And I
And
think it's much harder to dislike someone that you when you actually know them personally and see that they're a human being and see their vulnerabilities and see that, the things that are appealing in them. That's one problem with this COVID and with being on screens as opposed to being in person. It's a lot easier when it's impersonal like that to sort of hate people and to be nasty and to say mean things. It's a lot tougher when you actually are have another human being in front of you to act like that.
right. It is easy to do it when you're behind the screen and at the reach of a keyboard to go ahead
Yeah.
and say something to somebody. Um, so yeah, that's a really good point because of course things have changed and it has gone technology has played a huge part in Zoom conferences and
Right.
all of this and that is a way to do things and we have to adapt to it but you can't replace that in person get to know your neighbors get to know your friends although I'm seeing and I know people that even have alienated their own friends
I know. And
people that
family.
they're close to and families are
Yeah.
fighting and arguing and um, what do you think is an important? What would you suggest to those types of people that are dealing with
Oh,
frustration and
goodness.
and this anger thing?
Gosh, I wish I had I wish I had the answers for that.
Yeah,
Um, j I don't know, we gotta continue to talk to each other. I don't know. I mean, I do try with people to say not to take things personally and to not sort of, immediately anger and try to talk to people. But I do think sometimes it's tough because there are people that just don't want to hear things and don't want to listen. But I don't know what we do other than continuing to try to talk and continuing to be genuine, honest people and hope that eventually that gets through. And I do think that in this country, there are more of us that are decent and want to do good and are good people. It's just that sometimes the people that are louder and get more play are the people that are not like that. But I do think if you think about the people around you and think about how many decent people there are around you. There's more of us. I swear there are more of us, but we just got to band together and forget about the rest of those people and just keep moving things forward in a positive direction.
well, that's good advice, Dr. Lisa. I totally agree with that. And one of the things that I know that I try and practice on a regular basis is acceptance. Accepting another person for
Right.
who they are doesn't mean that we have to agree with them. Doesn't mean that we have to be mean to them because they don't agree or we don't agree. But acceptance really is an answer,
Yeah,
um, because then it puts you in the middle. And like you said, I think you made a good point. We can learn if we can open our minds up for half a minute from somebody.
right. Yeah, definitely. I mean, I think that is one thing with some of the conversations that have gone on in this country. When you listen to what people are saying, I never particularly thought I was particularly prejudiced or stereotypical or anything, but when you listen to what people are saying and then put yourself in their shoes as opposed to yours, you can sort of see how the world looks a little bit different from that perspective than from yours. And I think, you just got to be open to thinking about things like that. And hopefully we'll get to a better place. Hopefully
That,
this time next year we'll be in a better spot than we are.
so let's all be nice to our neighbors and our
There you
friends
go.
and our spouses and our kids, and like go take a walk in nature, go to the park, do
Right.
something. Take a break, watch a movie or something together. Let's just do something so that we can bring ourselves together. That's really awesome. Well, I really appreciate, like I had mentioned so many times already tonight, that how much how I am so proud of you for what you're doing at the Ybor Youth Clinic up there.
Thank you.
This is really awesome. I certainly know that if anybody is, oh, um, 1 second here, just everybody not paying attention to plugging in the computer. Must do that. There we go. Okay, so yes, where was I? All right. So, yes, looking forward to being able to send some folks your way here from Sarasota or up in that Tampa Bay area. We reach a lot of people. We do want to remind everybody that's watching the Facebook, if you happen to come in, we appreciate you very much. Remember to share this video out. There's a lot of great information that Dr. Lisa Sanders has been sharing with us tonight about infectious diseases. Um, if you would like, and you're living in the Tampa area, you can contact Dr. Sanders. I've got her email up there. You can also call that clinic, do that, because Dr. Lisa would like to be able to help you. And it's at no cost or low cost as
Absolutely.
well. Yeah. So maybe you can just wrap up here and give us your final thoughts on respect to the things that we've been talking about this evening here, Dr. Sanders.
So I think final thoughts is I think that there's plenty of reason to be hopeful.
Oh,
And
sorry.
I think that if we trust science and and believe in the system. We have made tremendous strides. I've talked about how we've made strides with HIV. I've talked about how we can treat STIs. I think we're getting there with COVID as well. I think the vaccines are going to change things. It's going to take some time. We need to continue to be smart, use masks, and be considerate of other people. But I do believe that when we get together this time next year, we're going to be in a much better place. And I'm hoping that this country, that we can all sort of sit back and be proud of what we've been able to achieve by working together. See, I don't know about everybody else. I can't hear you right now.
Okay, so
Now I
we're not
can.
going to get real quickly there about we got some vaccines that are coming up uh, pretty quickly. It's kind of out of the norm, but they've been on a fast track. Maybe you can talk about those vaccines and make a suggestion to the viewers.
So I think you're not going to probably, the way they roll the vaccines out, I don't know how much of a choice people are going to have in terms of which vaccine they get. I know everybody's antsy about the safety profile of these vaccines. We could have spent an hour talking about vaccines. Vaccine technology has come a tremendous way. All of these vaccines sort of stimulate your immune system. So some of them make you feel a little achy. Sometimes you get fever. That's what they're supposed to do, because what they're doing is stimulating your immune system so that when your immune system sees the virus, it's going to know how to react, and it's not going to and you won't get sick from it. Nothing we do in medicine is 100% effective, but I will tell you from the science of vaccines, all vaccines, even the couple that had a little bit more side effects than we hoped, like the swine flu one and the H1N1, all vaccines are way more beneficial and are way safer than the diseases that they're preventing. So these vaccines are going to be a way forward. They're going to start with giving them to the most vulnerable people, giving them to healthcare workers. Everything that I've seen shows that they are actually remarkably effective and remarkably safe. They're not going to be 100%.
Mhm.
There's going to be a weird immune response to these vaccines because that's what they do. But the vast majority of people, 99.9% more than that percent of people, are going to do well with these vaccines. They might have a mild ache in their arm, a mild, some fever and stuff. They're going to do well. And this is the way out of this, are the vaccines, I think.
That's excellent advice. Thanks for sharing that with the viewers. We certainly appreciate everybody that's taken time to come and join us. Again, remember to share this video out. Tell your friends if you're watching on Roku or Amazon Fire, Apple or Android TV. Remember, you can watch us on e360tv.com. We appreciate you. We hope you have an enjoyable weekend. Thank you so very much, Dr. Sanders, for joining us this evening and educating us about infectious diseases and the prevention of them.
Thank you again, Stephen, and thank you for everything that you do with this show, trying to get information out to people that they need.
Awesome. Thank you so very much. You have yourself a great weekend. We'll see
Okay.
everybody soon. Take care. And I'll just say bye for now. We'll be back on Monday. We'll see you then, 7 p.m. Eastern Standard Time.
All right. Take care.